I will introduce of HIFU treatment. Today's HIFU treatment case is 8 cm adenomyosis. She had no children and suffered from severe menstrual bleeding and particularly intense menstrual pain, which led her to visit the emergency room repeatedly before and after her period, using more than 3 strong narcotic painkillers. Despite this, the pain persisted, and after hearing about the possibility of a hysterectomy, she came in for HIFU treatment. The MRI images show that the uterus has increased to about 260 cc, measuring 8.7 centimeters. And the junctional zone of the posterior wall of the uterus is confirmed to be very thickened, measuring over 12 millimeters, indicating adenomyosis. The high-intensity focused ultrasound treatment for adenomyosis took about 90 minutes. Comparing the pre- and post-procedure, MRI images shows that the adenomyosis area has been treated well, with over 95% improvement. The MRI scan with contrast also confirmed that the overall lesion has completely necrosed, as indicated by the NPV non-perfusion volume immediately after the procedure. The pain and bleeding symptoms improved significantly, and the size of the uterus gradually decreased. When the patient visited again after 6 years, an ultrasound showed that the uterus had reduced to approximately 4.5 centimeters, decreasing from about 260 cc to around 60 cc, which is a reduction of over 77% and was well maintained.
When I was 38, I went to that hospital, and they said there was a little adenomyosis when they just looked at the ultrasound. But I went back 2 years later. It had grown a lot. So it grew, but the symptoms got a little worse. And after 1 or 2 years, the menstrual clots were really
when it
heavy.
happened,
It would come out for 2 hours. Even after my period ended, the pain continued, and since the bleeding only happens when I'm outside, the pain was so severe that I had to go to the emergency room, even with 3 different painkillers. The pain didn't go away. I was struggling even before my period started. And I was in pain for a whole month after it ended. It became so difficult to live that I started looking into HIFU treatment.
An 8 cm adenomyosis can be treated with HIFU without the need for incision, general anesthesia, or a hysterectomy.